My name is Natasha Sherman, and I am your host. And my guest today is Kerry Kay. She is a holistic health practitioner, practicing a variety of modalities, and we're going to talk about a couple of them today. Welcome.
Thank you, Natasha.
I'm happy to have you here for a lot of reasons. One of them being that I think it's really important for people to know that they have access to healing tools themselves. And I'm not suggesting they give up going to doctors or whatever, that's an individual choice, but I think it's very powerful to know that you have healing tools and techniques that you can practice on your own. So I know you practice a variety of modalities, but one of them is something called Jin Shin Jyutsu. So can you explain what that is to us?
I'd be happy to. Jin Shin Jyutsu is a system of hands-on healing, really. It comes to us from Japan. And it works on the premise that our hands are like jumper cables. Our jumper cables jumpstart our body's subtle energy system. And we can use our hands and use some simple holds to help ourselves and also help other people. I'm a practitioner of the work. I love using this work on people, but I also enjoy teaching people techniques that they can use and they can take with them on their way and they can use on a daily basis. And in most situations. Did
you not say to me in a conversation we had that Morristown Hospital has Jin Shin Jyutsu practitioners in the hospital?
It does indeed. In fact, I was one of those practitioners for 4 years, and I had the freedom to walk in and out of patients' rooms and also to go onto the pre- and post-surgical units and work with people really at any point during their hospital stay. It was quite an amazing experience to work with people at this level and to bring this kind of work to people who had never heard of these things, let alone actually tried them.
And how did the physicians feel about it?
I think in the beginning the physicians were very, well, let's see. No, maybe a nice thing to have. But what happened over time was that physicians saw that their patients were gaining real value from this. And it got to the point where the cardiac surgeons, for example, would call our office, the integrative medicine office, and say, would you please be sure to send a practitioner to this room, to this patient, because this patient is extraordinarily anxious about what they're experiencing. And so we would go and we would work with them and we would find that patients would feel better. Right. And actually while we were there, there was a kind of a casual study. It wasn't a real scientific study, but we practitioners were collecting data about the patients and the sessions that we would do. We would evaluate the patient before and after the session, and the patient would participate in that, and we would rate them on anxiety, nausea, and pain. And when the results were tabulated, the data was taken over a number of months, and the results, when tabulated, showed just extraordinary improvement in patients' states after treatment.
That's great. And I think what's great about that also, it's not just anxiety, because anyone can make a case for, oh yeah, just somebody showing up in your room can alleviate your anxiety. But you're talking about nausea as well and pain as well.
Yes, that's right. That's right. In fact, I remember one day I walked into the room of a patient, a woman in her early 60s who had just had open heart surgery. She'd had the open heart surgery probably 2 days before. And I found her in a moment of extraordinary pain, physical, emotional. And she was crying and really sobbing. And so I asked her if I could put my hands on her feet, on her ankles actually, and she agreed, and 10 minutes later she was asleep.
Wow. Wow.
Yeah. So she was ready.
Yeah.
She was ready.
Yeah. So let's do a couple of Jin Shin Jyutsu moves.
Absolutely.
That people can use at home.
Well, it's a stationary kind of practice, so rather than move, I'd say hold. And first we'll do the Jin Shin Jyutsu hug. So just take your hands, and you can do it too, and people who are watching the show can also do it, and just give this a try. Play along with us and see.
Exactly.
So place your hands in your underarms, and then close your eyes. I'll close my eyes too. And bring your attention to your breathing. And so that means just take a breath. Just follow your breath all the way in and all the way out.
So you're not doing anything to regulate your breathing. You're just breathing normally,
Exactly.
but giving it some attention.
Exactly, and we find that when we give the breath attention, that it just naturally slows and comes into a kind of equilibrium. And also what we do is we look to lower our shoulders, let them relax. We let the muscles in our face relax. We let our arms and hands find a relaxed place, and we let the belly go slack. And there's something else that we can do as we do this.
Mm-hmm.
It's a thought that we can have.
Mm-hmm.
When we breathe out, we can think, exhale, burden. And as we breathe in, we can think, inhale, abundance.
So inhale abundance, exhale burden.
Mm. And we suggest that you start with the exhale, exhale burden,
Okay.
so that you make room for the abundance.
I love it.
Yeah.
So there is a definite intentionality to this.
There doesn't have to be, but I find it really helps.
And when would I do this?
You could do this at any time that you're in a position to be able to put your hands here in your underarms. So now take a moment and relax your hands. When we do the Jin Shin Jyutsu hug, we're bringing in the sense of relaxation. It's a felt sense of relaxation in our bodies and in our minds. It's a wonderful thing. And but you know, if you're riding on a bus or an airplane, or you're in a meeting and you're starting to feel some anxiety or some kind of physical discomfort, sitting there doing the Jin Shin Jyutsu hug isn't probably a great idea. Maybe you want a more stealth method to to work with your body or to work with your emotional state. And so there is a practice in Jin Shin Jyutsu called holding the fingers, where we get to hold each of the fingers, and it's just simply wrapping our the fingers of one hand around. I always start with my thumb. And again, I can close my eyes, but if I'm in a meeting, I will keep my eyes open.
Right, good point.
Yes. And so I work with each of the fingers in turn. What's amazing about the fingers...
On both hands, yes.
On both hands, yes. I work with one digit at a time, one hand first and then the other.
Mm-hmm.
And when I hold each of the fingers, as this is an ancient art, whose philosophy is based on ancient Japanese, Chinese ideas, probably Taoist, who knows, maybe even pre-Taoist, I don't know. But energetically, the thumb is connected to the stomach and the spleen. So if you have an issue with your stomach, say indigestion, and in fact we say no tums, hold your thumbs.
Ah.
Interesting. Then the index finger is energetically connected to your kidneys and your bladder. Interesting.
Wow.
The middle finger, this always gets this gets a giggle from people. It's the liver and the gallbladder. But the funny thing is, well, interesting thing is that the fingers are also connected to the emotions, and in Jin Shin Jyutsu, they're called attitudes. So this is the anger finger.
So the middle finger is no accident.
Interesting, isn't it? I don't know how that happened, but the ancients were wise ones, I suppose. And so
but, the liver is also, when they talk about flushing the liver, sometimes you'll experience anger.
That's right. That's right, indeed. And then the ring finger is lungs and large intestine.
So if you had a respiratory thing going on, you might do that?
You might hang out here with this finger longer, yes.
Is there an emotion attached to that?
Yes, it's sadness or grief. Then we'll go on to the little finger, and I'll talk about the emotions of the first two, and we'll review if you like.
Yes.
The little finger is heart and small intestine. Interesting, hey? I keep using that word. I should find another word.
No, it is interesting. So what's the emotion here?
This one is a little more difficult to explain. We call it the try-to or pretense. So the try-to, as in I try hard at what I do, or I'm always trying. The pretense is I pretend. I pretend that everything's fine when really it's not. Or I pretend to be happy when I'm sad. So try to or pretense. And then going back to the stomach, this is worry. You think about the little kids who suck their thumbs. Are they worried?
Wow. And what's interesting here is you said it was stomach, and very often worry gets expressed in the stomach.
It does. It does. You know, how many times have we had emotional upsets or been worried about something and we've had some sort of stomach ailment come on?
Right.
And the index finger then, this is fear. So this is kidneys and bladder and fear.
Okay.
And the woman that brought this work to the US from Japan, her name was Mary Burmeister. She was a philosopher. In fact, Jin Shin Jyutsu is considered to be a physio-philosophy. So physio and the body, and philosophy, a philosophy of the body. And she's not the only person from whom I've heard this, that fear is merely an acronym for false evidences appearing real.
I've heard that, and I think it's great.
It is. It's fabulous.
Yes.
And it's another reminder that
Right.
you know, being in the moment is really the place to be.
Yeah.
You know, yesterday's gone, tomorrow's not here. All we have is now.
Yeah, and sometimes fear is real if there's somebody,
Yes.
but typically we are anxious when there is no clear and present danger.
That's right.
And it's our minds that are taking us to a place that has nothing to do with right now.
That's right.
Yeah, so this is very useful. And I think that even if you have no specific ailment going on, the fact that you're doing this and you're sitting in a meeting is your moving energy.
Yes, and of course you don't need to be sitting in a movie, a meeting
you
or a
could be in a
movie,
movie.
but you could be, yeah, you could be waiting for a doctor's appointment, you could be riding in a plane. This practice is also great for jet lag. I'm originally from Australia, my family is still there, I travel back, and I can tell you that when I'm holding my fingers on the flight, it helps me stay calm, it helps me doze, maybe even sleep, and then when I get to Australia, I hit the ground running. And then when I come back to the US, because this is where I live, and I'm dealing with a 14-hour, sometimes a 16-hour time difference, depending upon the time of the year, it really helps me to reset my diurnal clock, and I come back into the regular time schedule here.
Wow.
More quickly.
So the question is, about how long do you spend with each finger?
I say to people who are doing this for the first time, try it for a minute, each finger, and see how that goes. And if that feels too long, just move on to the next finger. Don't let this be a discomfort. Find a place of comfort for yourself. And we're all so different. And with practice, you'll be able to hang out with each finger longer, but a couple of minutes is going to be plenty. Don't wait until you have an ailment to deal with.
That's good.
Do it now.
Yeah.
Maybe it's a good preventative tool.
Yeah, as a daily practice. I think it's
Exactly.
great. And we're always, at some point, if you're sitting watching TV at night, you could take care of your well-being just by holding your fingers.
That's right. That's right. And then it becomes a case of remembering that
Right.
the tool is there.
Right.
And like anything else too, any of these practices of this nature, it's also experiential. We can talk about the theory and I can, demonstrate to you, but it's not until you actually try it that
Yes.
you understand the power.
And I suspect you have to try it more than once.
I think so.
Yeah.
I think so. And I also find too that, for me, with the many modalities that I have sampled and even studied, sometimes the first is the most powerful.
Yes. Yeah.
Because there's that wow factor.
Yes.
Oh, wow, this is real.
Yes. And maybe that's all you need to keep practicing it, is that experience sometimes. Because,
Yes. Yeah.
And I think the only other thing I would say about it is, don't look to repeat the experience, or don't look to have it be the same, because that will just set you up feeling like you're not doing anything and nothing is happening, and your body is different every day.
I'm so glad that you mentioned that. Our body is different every day, and our body is even changing during the day.
Yeah.
And of course we have the mind, and of course, who knows where the mind-body connection actually is, but Jin Shin Jyutsu is one of the modalities that works with the connection.
Right.
Works with the connection between the mind and body and brings our whole system into harmony. And harmony is a big word in this work.
And you are a practitioner, and people can get in touch with you and find out more and even come to you for a session.
Yes.
The other thing, and now I want to jump into something totally different that you
Yes.
do, that seems on the opposite end of the spectrum, but really isn't, because it's all about mind, body, spirit, and connectedness and harmony. And it's something called Family Constellation. And initially, when somebody described it to me, it sounded like therapy, you know, psychological therapy, emotional therapy. And yet, the little reading I did and the talking to you, it's something distinct from that. But just tell me briefly the premise of Family Constellation and why somebody would come to you, you know, in terms of what is it that they're looking for that this would be a match for.
I'll try my best to do that.
And I know it's tough, but
yeah, this work, of all the modalities that I practice, it's sometimes the most difficult to describe and to talk about in a way. A person would come to me when they have really struggled with an issue. Maybe they've been in therapy for 2 years, 3 years. Maybe they've tried everything out there and nothing is working. And Family Constellations really is a form of therapy. And sometimes, or I should say often, we see that it seems to shorten recovery time. Or, you know, we see people who have been in therapy who find that doing the constellations work just seems to almost magically resolve the problem. I remember a while ago I was working with a woman who was struggling with an issue in her office at work. She worked with several women, and there was a lot of discord in the office and lack of respect for people, disconnection, things not being communicated. And she felt that that the root cause was within her, and she had been talking to a therapist about this work situation, and she did constellation work. And it was interesting that the issue was reflected within her family, and the session that we did was very kind work. It was in a group situation. People participated, and we'll get to more details shortly. But the end result was, when I saw this person several weeks later, she reported that she was astounded that there had been a total shift in the office and in her work starting the next week. This was on a Friday night.
So she didn't go back to them and say, oh, I learned this, I learned that.
No.
Something had shifted internally that then got manifested in her
work situation. Yes.
So they didn't have to be there.
No, they didn't have to be there. So how does this happen?
Yes.
It is such a mystery, and I capitalize that word. So we're working with the family field. We're working with the systemic field.
So when you talk about a field, we're not talking about a field. We're talking about kind of an energetic field,
exactly,
psychologically linked field,
yes,
emotional field.
Yeah.
Okay.
The field of connection, that field where we're all connected. It's that place where, when the phone rings, you say to yourself, "Oh, that's my sister," and you pick up the phone. It's your sister.
And I suspect, in some ways, it could be when you walk into a room full of people. There's certain people you're drawn to. There's certain people that you're kind of stay away from, and nothing has happened, but you have a sense, and so there's some energetic thing happening going on.
Yes, yes. And I suppose that I could say that Family Constellations gives us the opportunity to ask the question, so what if this problem I've been struggling with is not my own? What if it belongs to somebody else? Who would that somebody else be? Well, because it's Family Constellations work, we look at the family. And we find that the family becomes a representation, really the font of how we are in the world. It's the place that from which we are created and sets us up for how we go out into the world. So with the Family Constellations work, we have the opportunity to see a picture and a real illustration of an element of our life that we might be struggling with, or a way to ask a question about
So can we talk
life.
about kind of like if I were a fly on the wall, what would I see happening? You have a group of people, and let's say I'm the one with the issue. And I have this issue that's been following me around, and let's say it has to do with relationship. So all my relationships fall apart, let's say, which is not the case, but anyway. So I come, and again, I've been working at it. So I come, and you're saying that it could be a reflection of the family system. It could be somebody else's issue that I've taken on.
Yes, exactly. And I could give you an example of that.
Okay, good.
It may be, well, as we sit in conversation, and we, as facilitators, we try to get to the essence of the issue for the client. We try to get to the heart of the matter, and so that requires some deft questioning and sensing. And often what we're looking for is a loss of some kind. And so I would ask you about your parents, and you would tell me, oh, they're fine, you know, or don't have any problem there. And I'd say, well, was there somebody in your system who died early? And you might sit there and say, wow, I haven't thought about this for a long time, but I remember that my mother's father died when she was very young. And I'd say, well, how old? Oh, she was 11 years old. Well, 11 years old is a very young age, of course, to use a parent. And we find that this kind of situation is one that comes forward. It affects not only that grandmother, the woman, that young child who becomes a woman, who becomes a mother herself, has a child. It affects the generations that follow. There's pain back there. It's very hard to look at it. And somebody in a future generation will energetically carry that in some way, and it gets reflected perhaps in relationships that end. And so what we would do in that situation is we would go back to that point in time, and we would ask the client to choose somebody in the circle, somebody in the room, to represent that grandmother who died, or the grandfather who died. And I'm not sure at this time, but we are probably the daughter. And we would ask the client to place each person in the center of the circle as an outpicturing, or in sensing the way that she's taking in that dynamic, that incident at this point in time.
So let me get this straight. So she's uncovering that there was a loss that her mother experienced when she was very young. And that, so now she takes people to represent her mother and then her mother's parent who died. And she physically places them in such a way that just feels right to her.
Yes, that's right. That's right.
Then, so now there they are, and she's there, and then what happens?
Well, it depends, of course, on how the representatives are showing up.
Okay.
You know, how is each representative showing up as the father who died and the young girl who lost the father? So we are looking at body language. We're looking at the position that each person has been placed into. Is the father looking at the daughter? Is the father turned away? Is the daughter looking at the father as she turned away? Does the father have a sense that he wants to fall to the floor? This is a sign of death. You know, is the girl able to see her father, or is she looking way beyond?
You know, it's interesting here because I get a visual of almost like someone directing a movie, but in the process, the players are kind of drawn in by her energetic field, if that's the right word. And so they're not only being themselves, being someone else, but they're actually, something is being called forth in them. And then she is responding to what's out there and showing up. You're guiding the questioning. And then what happens in that situation? How does a healing occur or a breakthrough occur?
Well, one thing that's very important to point out is that the representatives are, yes, they're themselves, yes, they're representing those family members, but they're also receiving towers for those people, that young girl and that man. And they are,
dead
believe
or
it or
alive.
not, dead, yes, dead or alive. In this work we find that the dead are often vividly alive and influencing our lives to this day. It's scary sometimes. and then it's also very reassuring somehow to know that we do have this
lineage.
incredible, lineage, and this incredible access to the love and to the support. That's the primary thing that we see. And so these representatives are receiving information really from the field, and that's the field with a capital F that Lynn McTaggart talks about, that Rupert Sheldrake talks about. And I'm sure a lot of your viewers are familiar with such work. So in answer to the question, well, what happens? How does the healing happen? It comes about, firstly by the client actually seeing this and seeing the love that exists for the daughter, the love for the father, and that it's like going back in time. It often it's like seeing something for the very first time. And it's like new information comes in. It's like an old story drops away, and we see a new story. And then the representatives sometimes will have a sense that they want to express something. It's like they're getting a message, and they want to express it, and that message is received by the other person, and it goes right to the heart, and it's like the soul takes it in. The client sees this, and later we can actually bring in the client, or we can bring in a representative for the client, so that the client gets a more vivid sense of what's happening. Sometimes the facilitator will find a sentence for one person to say to the other, and that again reinforces that sense of very deep love and acceptance, the love, no matter what kind of love. And when the client comes in to the constellation as herself or himself, depending upon the case, they really have the opportunity to experience a very deep sense of peace, of resolution, eventually.
And a different family dynamic, I'm assuming.
Yes.
Unfortunately, we're at the end of our time, but I invite people to explore this further if it piques any kind of interest, because it sounds like it has huge potential. And it sounds like there's access to so much that isn't traditionally accessible to us.
That's correct.
Yeah, so thank you. I know it's a difficult subject to explain in such a short period of time, but I think you did a great job, and certainly there are other questions that can be answered just by getting in touch with you.
Absolutely.
So thank you so much for being here today. There was a lot of information, and I think rich and valuable, and thank you so much.
Thank you, Natasha. I've enjoyed it.
My name is Natasha Sherman. Thank you for joining us.